Good evening, Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to yet another episode of Truth to Power. My name is Faraz Patel, and I will be your company for the next 45 to 50 minutes. Well, on the 17th of May, government's phase 2 of the rollout of the vaccination to curb COVID-19 kicked on. Now, officials, of course, hope to reach 5 million senior citizens by the end of June. Of course, this is people over the age of 60 in order for them to go ahead and get their jabs. So far, well, according to many, it has seen a bit of a success, but there has been issues that have been dealt with by the respective healthcare officials. Well, to break this down for us, I've invited Dr. Nicholas Crisp. He is the Deputy Director General of the National Health Insurance. Dr. Crisp, good day and thank you so much for joining us here on Truth to Power on ITV Networks.
Good day, Faraz, and hi to your viewers. Thanks for having me.
No, it's an absolute pleasure. Dr. Crisp, so far what you have seen over the last week and a half, how would you sum up the phase 2 of the rollout vaccine so far?
Thanks very much. Yeah. So more successful than unsuccessful. As with any new program with so many moving parts and so many changes, there have been hitches and there have been quite a lot of challenges at various points in the system that have been brought to our attention. But we have been overwhelmed by people who have written to us and thanked us and congratulated us on what has happened. So I think it's a balance, and what is very encouraging is that it has improved every day. And this week, I hope, will be significantly smoother than last week.
Dr. Crisp, now the commonly asked questions, and we just try to get from across our viewers, is the jabs itself. Okay, so how does the jabs go ahead? How is the storage process? Because from my understanding and the understanding of a lot of people, it needs to be in a certain, obviously, degrees Celsius. So can you give an idea or just somewhere where you can maybe give an explanation to how important is it to have it stored at a certain degree Celsius in order to maintain the durability of these vaccines?
Okay, so without getting too technical and without trying to be a scientist myself, I'm a medical doctor, so I have a reasonable insight into these things. Let's try and keep it a little bit that a layperson can follow.
Yeah,
so a vaccine is not the same as a medicine. It's not a chemical compound. It's a biological product. And biological products are damaged by light and heat and exposure to cleaning materials and chemicals and so forth. So their storage is very different from a medicine. This particular vaccine, the one that we are using now from Pfizer, is the way in which it is manufactured has to be stored centrally after it's manufactured at extremely low temperatures, -70. Now that's colder than you get above the highest point at which airplanes fly. So it's extremely expensive to create refrigeration conditions at -70. So by the time it gets to us and we get it into our arm, if we injected something at -70, we would do significant damage to the person. So it must be at room temperature by the time it gets into our arms. But every time the vaccine decreases its temperature or is thawed to room temperature, it only has a certain lifespan before it is no longer effective because it's a biological product. So the trick, I guess, in the health system is to manage the central part of the distribution network so that the vaccine stays frozen at very cold temperatures as long as possible, and then not to break the bulk into smaller distribution points too fast because we don't have -70 or even -40 or -20 vaccination storage capacity everywhere. So there are points around the country, in the public and in the private sector, that have been certified for storing smaller volumes of the vaccine at slightly lower temperatures, but that can still be kept for a long time. Once we get to the vaccination site, we have two options. One is to thaw the vaccine overnight, and the other one is to thaw it at room temp. That's to take it down slowly to a normal fridge temperature. And the other one is to thaw it more rapidly over 15 minutes in small doses, single vial doses, at the vaccination site. So obviously, you don't want too much vaccine being brought out of the fridge and into an environment until you know that you have people to vaccinate. So I hope I've kept it reasonably straightforward, and I'm sure you'll have follow-up questions, but it is something that health professionals have now in the field have been trained. This vaccine is very different from other vaccines that they are familiar with because none of our other vaccines are stored at this very cold temperature.
Yeah, and I think the follow-up question to that is also the fragility of everything else, because we've got vaccines, as you say, it needs to be at minus 70 degrees Celsius, and there can't be any room for error in terms of when it gets to the site and, of course, when the inoculation starts. So how is the training with regards to the frontline workers and those, of course, distributing the vaccines, and the training that needs to go to it to make sure that the fragility is kept in order for the process to be successful?
So I think all of us around the world have learned an immense amount about the value of digital communication in this period. And all the training takes place from the central perspective digitally. And then within the provincial administrations, there's a degree of digital training that takes place. In the old days, we would call everybody to a central point. We'd train a trainer, then the trainers would go out and they'd do demonstrations and you do live things. First of all, this stuff is expensive, so and it's a rare commodity, so we don't want to be using too much of it in sort of physical training environment. But secondly, because, I'm having this interview with you sitting very far from your studio, and this is the way we do things these days, all of us. So the training of different groups of people for what they need to do, those involved in, it's mostly pharmacists who understand this central storage and distribution and cold chains and so forth. They are trained digitally as well. And then the training of the actual healthcare workers who are doing the vaccination is mostly digital training, and large numbers can be trained at one time.
Dr. Chris, the enthusiasm of people, I think, is something that we've seen over the last 10 days. And I think if that's the way it's going to go, then it's a good sign, because people are slowly buying into the fact that vaccination is something that needs to be done. From your viewpoint, from an NHI viewpoint, and from a medical doctor viewpoint, this can only serve as something positive, that the enthusiasm so far, you've seen various media houses go to various vaccination sites, and you can hear the senior citizens themselves are saying, you know what, we want to be part of this process, we want to be vaccinated, so we can go back to a life that we had before the pandemic started.
Yeah, absolutely for us. So look, I think anywhere in life and in society, you will get those who are enthusiastic about something and those that are totally unenthusiastic about something, and then a small group of people in the middle that are neither here nor there. So for those who have been enthusiastic, engaged, positive, and have registered themselves, a big thank you and congratulations. And don't panic. The system knows about you. You are registered. As sites become available close to where you live, you will be scheduled, you will get an SMS, and you will be asked to come for a vaccination. We'll deal with some of those details later, I hope. For those who are skeptical or ambivalent, talk to your colleagues, talk to your friends, talk to the people around you, understand their experience, and hopefully we can convince you that it's the right thing to do. It will protect you and those around you to be vaccinated. For those who are totally negative and who believe all the conspiracy theories and so on, that's most unfortunate, and I don't think it does society as a whole any favors. But, to expend the effort to try and explain to someone who's made up their mind they don't want to vaccinate, our Constitution allows you that freedom, and if you don't want to vaccinate and you're absolutely rigid about it, well, that's your right. And I don't think we're going to try and force you to do anything that is against your will.
Well, Dr. Chris, we are going to be, to sort of like erase the myth, we are going to be talking about that after the break, because I think it's important that people, as your medical doctor, as somebody who works at the NHI, to sort of bring a bit of ease and just trying to convince the people, and if they do buy it, why they should be vaccinated. But we will be touching with that after the break. Truth to Power, today we are discussing phase 2 of the vaccination process that is currently happening across South Africa. Stay tuned. Welcome back to Truth to Power, in conversation with Dr. Nicholas Crisp. He is the Deputy Director General of the National Health Insurance. Dr. Crisp, right, I know a lot of people, I don't know if you've encountered them, a lot of people are skeptical. So they say, okay, well, do we take the Pfizer one? Do we take the Johnson & Johnson vaccine? One's got a lot of antibodies, the other one makes you develop blood clots. I have had two elderly people in my family. They are very close members of my grandparents. They've taken the Pfizer vaccine and they said everything has gone well. I have a grandmother who's at the age of 87. She herself has told me that she's very skeptical about the vaccine. I have parents over 60 who themselves are skeptical about the vaccine. Dr. Crisp, I want you, if there are members or citizens of South Africa watching this and saying how are having the same sort of perception as my parents and my grandparents, ease them. I want you to give them an assurance of why the necessity of the vaccines are there.
Okay, let's try and understand a little bit, again, not in highly scientific or medical language. So let's understand about immunity.
Right.
So when in our everyday life, you and I and everyone around us are exposed to germs of various descriptions, all kinds of bugs, bacteria, viruses, and all other kinds of things that we either get exposed to in the air or the things that we touch. When we do that, those organisms that we are exposed to have proteins in them, and our body recognizes the enemies, the ones that are aggressive to our system. And we have, most of us, good immune systems that generate two kinds of immunity, basically. I'm not going to go into the details, but they generate an immunity which then neutralizes that protein. And there are different ways in which they do that. But it's our own body that makes the immunity. So what we do with a vaccine is we take the enemy organism and we expose the body to something that is similar but different. So it's not something that's going to make you violently ill, but it is going to tell your body that this is something alien to my body. And it tells your immune system to create a reaction to that stimulus that we've given you. So the vaccine is not the virus, but it is part of the virus. So these days, in the old days, we made vaccines by taking a virus or a bacteria and killing the virulent part, the aggressive enemy part of it, but actually just injecting that virus or bacteria into your body. These days, there are different mechanisms where we can make that protein in a laboratory. And the advantage is we can make millions and millions of doses far quicker than with the old technology. So I think that what's raised people's anxiety is that how is it possible to develop a vaccine so fast, I mean, in the space of just over a year, whereas previous vaccines have taken 10, 20, 30 years to develop. And the answer is that the technologies have been evolving extremely fast in the attempts to find solutions to malaria, HIV, river blindness, and all kinds of other diseases that we get exposed to in different parts of the world. So the technology is not brand new, but the solution is new using the technology. It's that anxiety, and then of course you get somebody who puts out some rumor in the public space, and then it goes wild and gets bigger. So vaccines are a biological product that introduce a protein or a foreign protein into our bodies that we make immunity to. And that's really all we need to know. It's not the virus, the vaccine is not the medicine. Our immunity is the medicine that deals with the virus when we get exposed to it in time.
You see, Dr. Chris, and that's my follow-up question, because I've had cousins of mine, some of them are working in the public hospital space in Cape Town, and some of them are working in the private hospital space in Cape Town. Now, when I did speak to them ahead of the show, they told me, okay, so The Johnson & Johnson vaccine, for example, will make us feel sick for a day or two, but then after that it should be okay. The Pfizer one, on the other hand, has the opposite effect. It doesn't really make us sick. So if we're looking at these two vaccines, of course, which are being currently used in South Africa in the phase 2 process, is that just part of the process that a lot of people would feel? And I'm not just talking about the healthcare workers, but also those who are currently senior citizens.
Okay, so the short answer to it is when we get exposed to organisms that our body fights, we feel lousy.
Yes.
So if you get exposed to some virus that causes diarrheal disease, you feel lousy. And part of it is you feel lousy because your body made an immune response. And the immune response might cause a temperature, it might cause drowsiness, it might cause you to feel just general malaise. And it may be a severe reaction if you mount a massive response. So it's the same thing when we give a vaccine. And my immune response and your immune response will not necessarily be exactly the same. So some people have no reaction whatsoever to any vaccine. But there are a very small number of people who do get a severe reaction to a vaccine. In between, there are people who get a mild, maybe a little bit of a fever. They might feel a little bit of what we call malaise, this tiredness and listlessness as a result, and then they're fine. And both vaccines can cause your body to make an immune response that makes you feel bad for a while. It can also make a local site irritation from the fact that you got an injection. Those are normal, but the severe side effects are extremely rare. And we know this because hundreds of millions of people have been vaccinated all over the world with both the vaccines that we're talking about. And the numbers that are being reported of severe reactions are infinitesimal. So, if you go out in the traffic now and walk on the street, the chances of being run over are small.
Sure.
But there's a chance. And sometimes if you wear dark clothes and you do it at night, you might get run over more readily than if you do in the daylight with a bright clothing on. So that is what we are trying to do in the health professions, is to make sure we know how to recognize and protect that people do not get vaccines if they're at risk, or what to do if somebody does get a reaction.
Yeah, you actually brought up a valid point with regards to, anything can happen, anything unforeseen can happen. I mean, I play football every Friday night, and the chances of me getting an injury can happen because, you know what, it's active, a competitive sport. Dr. Crisp, so the conspiracy theories, because I know this is something that I get thrown all over the time when I tell everybody, look, there's a vaccination process going on. Are you guys interested? And the first thing that they do is they say, well, you know what, certain vaccines contain this here. But you've put it well already that, of course, there are proteins or certain sort of biological aspects that do come for it. The conspiracy theories, is that something that is a danger and could easily hamper what is government's idea of trying to get all these phases achieved in a very short time?
Yes, of course, because every time somebody puts out false information or one of these conspiracy theories, they undermine the confidence in the program. And for me as an individual, if I've either been infected and recovered, or if I've had a vaccine, I have a fair degree of immunity, and we are learning more about COVID, but we are now understanding how long that immunity is for and how good that immunity is. And we know for sure that if you're vaccinated, your chance of getting severe illness, even if you do get sick, your chance of severe illness is dramatically reduced. And that's what we want. If I get sick and I have to stay at home for a few days because I feel lousy, it's one thing. But if I have to be admitted to hospital and in intensive care for a week or 2 weeks or 3 weeks, that's a whole other ballgame in my life, and I might die. So we don't want people spreading rumors, obviously, and spreading stories and undermining the program. Now, that's at a personal level. At a community level, what we as scientists and medical people talk about as herd immunity, and the president talks about as community immunity, is you have to see this in, it's quite hard to explain. If I'm the only person that's immune in a group of 100 people, the other 99 are vulnerable, and if one of them gets exposed, the other 99 are at risk. If 70 of us are immune and the virus is introduced, and one of the 70 of us is the one who gets infected and fights it off, only 30 were vulnerable. The other 70 of us are protected, and it might not spread to those 30 because the one of us who got infected and the other 70 who are protected will kill the virus before it spreads to the 30. So that's how community immunity or herd immunity works. The higher the proportion of the total population that has immunity, the lower the chance of the few who do not have immunity are from ever being exposed to a real infection.
Well, after the break, we're going to be unpacking future vaccination plans with Dr. Crisp. Of course, myself as a 30-year-old, or just over 30-year-old, what is the plan with regards to us as the youth of South Africa and going forward? Stay tuned to Truth to Power. Welcome back to Truth to Power. I'm in conversation with Dr. Nicholas Crisp. He is the NHI Deputy Director General as we are discussing phase 2 of the current vaccination process to curb the spread of COVID-19. Dr. Crisp, before I go to future vaccination plans, this is a question that a lot of people ask me all the time. Now, my understanding, I did not do biology in school, so if you can correct me on this, please, I'd really appreciate it. Vaccination doesn't stop the spread of COVID-19. Am I right? And the follow-up to that is, even if you do the vaccination, what are the chances of you still getting the virus if no protocols and that are followed?
Okay, so the short answer to your question is, at some point, when enough of us have immunity, then the vaccinations will stop the spread of the virus. Okay. That's what we've done with polio, which we have not seen in South Africa in a wild state since 1984. 82, I think, was the last wild case polio. We have not seen smallpox for as long as most of us can remember. And I mean, I'm now of an age where I was still vaccinated for smallpox. So the bottom line is you can eradicate diseases with vaccination, provided you get enough of the community vaccinated, and provided the virus is not mutating every time so that we are having to chase our tail every time. So it is possible. But what we are busy with at the moment is not trying to eradicate. We are trying to contain and control severe infection. And the reason for that is because people die when they get severe infections. But not all of us will get severe infections if we are exposed. Many people will tell you about being infected, having a positive test, being mildly ill. Some of them don't even really get ill. And in fact, we believe a large number of people have what we call asymptomatic infections, where they show no illness whatsoever. The problem is for those who get severely ill and those who die. That is preventable if we are able to get sufficient immunity for those individuals. So we know from the past year that the best indicator for protection of people who are at risk is age. People over 60 are at greatest risk. And what makes that group of people vulnerable is, it seems to be age alone is already an issue. But a large number of people over the age of 60, and a disproportionately large number, have a significant number of comorbidities which create problems. Diabetes and hypertension and other lung diseases and so forth. And this is a respiratory illness. So if people have any form of a respiratory weakness in that age group, they are extremely vulnerable and they will get sick, and they have a far higher chance of getting so sick that they need hospitalization, ventilation, and they may die. So the reason we have chosen to focus on the over 60s in the general population is that we can't line up people in a queue and ask them, have you got diabetes? Have you got hypertension? It's laborious, and it's easy to lie without having to do tests on everybody and verify. But asking someone, are you over 60 is easy to verify with an ID number, because our birth dates are part of our ID number. So the quickest way to start breaking the number of severe infections in our community is through getting the 60-year-old pluses to come and be vaccinated. I mean, I didn't mention, of course, our first target with healthcare workers, because if young healthcare workers do get sick because of comorbidities or because they were just unable to form immunity, then we've got nobody to look after those who do get sick. So I think it's obvious. You start with your healthcare workers, specifically the healthcare professionals who work face-to-face with patients. Then you expand to the broader healthcare support infrastructure and the over 60s. So that's what we've done. And when we have sufficient portion of those over 60s vaccinated and protected, and therefore not flooding into the hospital systems when they get sick, we can introduce to another age cohort.
And Dr. Crisp, just to follow up on that, I mean, as you say, the achievement of immunity is necessary in order to make sure that the vaccination can immediately stop the spread of COVID-19. Because, like I mentioned earlier on, my dad, he unfortunately had COVID-19. He did survive it. But this is something that we don't want to see again. I don't know if you had a family member who, of course, suffered with COVID-19. But so many people have seen their loved ones being lost or affected by COVID-19. So the achievement of immunity is key. Am I right in saying, to achieve the total eradication of COVID-19, or even just curbing the spread of it from wholesale spreading of it?
Yeah, so, I mean, you're absolutely right. What we are trying to do is prevent severe infection. That's the first. If we can do that, we've already won a large part of the battle. There are other battles to be fought about containing and, we know we're near talking about eradicating COVID. At this stage, it is curtailing severe infection and beginning to contain the virus so that we can get on and have our economy and get our lives back. And the more of us who get vaccinated, the better. But the first instance is to protect those who are the most vulnerable. So I do want to encourage people to come. I think all of us by now know somebody who has been infected. And certainly for those of us who work in the health profession, many of us have lost colleagues and friends, and the list is becoming longer by the day. That is not something that any of us wants to see continue.
Dr. Crisp, future vaccination plans. This is important, especially from a youth like myself of the country. Can you give the viewers an idea of what the future plans are for vaccination? Because a lot of us want to go back to our lives. We want to be in the social circles. We want to start traveling. We want to start doing things that we really loved and enjoyed before the pandemic hit in. So could you maybe just share us an idea of some of the future vaccination plans that are going to be happening, and what is the time frame for that to be achieved?
Yeah, so the first issue is that we don't have access immediately to all the vaccines that we need, but fortunately we now do have a pipeline of purchased vaccines that is coming in on a weekly basis into the country. And that means that we are now able to make plans knowing that we do have this pipeline of vaccines. And because we know those volumes and we have a reasonable idea of the dates in which they will become available for use, we can ramp up quite significantly to meet the supply. It's taken a while to get there because I'm sure everybody's aware there's a huge global demand for vaccines and a big fight. It's not that easy to get these vaccines, even if you are able to pay for them. So we are fortunate that we do have now 2 different vaccines in the pipeline coming. Now, you can't set up a huge vaccination delivery system if you don't have vaccines in the pipeline, where you have staff sitting, waiting, and sites that are established and ready to go, and there's no vaccine. So the challenge for us in the health sector, both the public and the private sector, and I must compliment everybody who's been involved, both in the provincial departments and in the private sector provider environment. There's been a lot of cooperation to try and synchronize and make sure that the supply pipeline together with the availability of sites and the initially this past week slow ramping up and learning of the sites, and now a very rapid ramping up of availability of sites, is going to match the supply. And it's not only vaccines we have to supply, of course, it's syringes and needles, and they're not just any old syringes and needles, they're particular for these very small doses that we are giving. So all the providers have had to get themselves very organized. And then the third component is we need to track what we are doing. We need to know which dose we gave to whom, what was the batch and lot number. We need to be able to check that there's equity and fairness in the way in which we are distributing and managing the program. We need to know how we can schedule the next group of people so that we don't start overtaking the older population before we start introducing younger people into the system and so forth. And for that, we have a very sophisticated electronic vaccine delivery system management system. And we are very happy with the way in which it's working now that the scheduling is starting to happen. 5 provinces in the public sector are fully in control of their own vaccination schedules. All the private sector sites, as they get brought on, have control of their own schedules. And by the end of this week, the remaining 4 provinces will also have full control of their own scheduling. This makes it far easier for them to plan and to execute and manage. So if things go according to plan and are as smooth as they have been now during this transition, and as I say, it's improving every day, then we will get through the bulk of the over 60s by the end of next month. And as soon as we see we are nearing that point, there will be announcements made by the minister about which next cohort. So you can imagine it'll either be 50s to 60s or 40s to 60s, depending on the bulk of our estimates of volumes that we're able to manage. And so it will go on. There's no evidence that vaccinating children adds value. So at this stage, because of the cost and the logistics involved in the vaccination program, there's no plan now to consider the vaccination of children. I know other countries are doing it. And if you have a lot of money and a lot of time and you can secure the vaccines, that is what they are doing. But globally, it would be better for the whole world not to vaccinate children, but to vaccinate the economically active people around the world before we start vaccinating children. It's not to say we won't ever get to vaccinating children. That will be important when we talk about eradication. But for now, for the global economy, for transport and getting us all moving again, it is more important that we focus, first of all, on the over 60s and then on the economically active portion of the population.
Well, after the break, I will be continuing my conversation with Dr. Crisp as we move into the last section. Today on Truth to Power, we are discussing phase 2 of the new vaccination process. Stay tuned. Welcome back to Truth to Power. I'm in conversation with Dr. Nicholas Crisp, Deputy Director General of the NHI. Dr. Crisp, now a lot of people have had their skeptics about government's plan for the vaccination process. Phase 1 had its success. Phase 2 has had its success also. Would you say that government has in some way sort of justified why it was necessary to go ahead and plan this in its phases? And number 2, at the same time, sort of like thrown away the critics and said, give us time, we will achieve herd immunity, number 1, and we will have, over a period of time, every single citizen, should they buy into it, vaccinated?
So for us, we were fortunate to be able to participate in the Sisonke trial or in the J&J trial. But there was a limited amount of vaccine that was made available because our South African Medical Research Council has global status and have been a research body involved in vaccine trials for many years. So that was extremely fortunate. That trial specified that it would be for healthcare workers, which we were happy about, of course, because that's our first target. But it was not sufficient vaccine in the trial to cover everybody in the population. And we knew it would come to an end, and we knew it would have to be terminated at a point. And that point arrived. Fortunately, by the time we got to the full use of that vaccine, we had secured doses now of a different vaccine, Pfizer, and so that is why we are rolling out. Obviously, the transition from one vaccine to another, especially because one is a single dose and the other one's a 2-dose, the one is under a trial protocol, the other is under open public protocol. It's different. It's different for the staff on the ground. It's different for the logistics of the distribution of the vaccines. And we had to switch over a weekend. And there were lots of challenges with doing that. Partly because it took longer to terminate the electronic management of the data out of the Sisonke project than we had expected. And partly because switching on the new set of rules onto the system had to wait for some of those same processes to conclude. I mean, these are technical things which we don't expect the public to have to worry about, but it explains why we sent the SMSs out late on Sunday night of the 16th, because we were delayed while we shut down one system and geared up and opened the next one. Also for Monday, the provincial administrations in the public service had plans to use their vaccine and get to old age homes for people who had been unable to register. And that's a labor-intensive process, a transport-intensive process, and they had to get out. So their sites could not all be fully staffed during the day on Monday. And so we were only able to send out a limited number of SMSs to people to go to the sites when those staff returned from their visits to old age homes. Tuesday was a pretty similar process, and by then we were able to start bringing on the first of the private sector sites, because it's a registration process where they need to be licensed with the Pharmacy Council. Then they have to be brought onto the total database where the geolocations are, in other words, the physical address on the computer system is absolutely clear. Otherwise, we send people to the wrong place and so forth. So the gearing up site by site started over the weekend of the 16th, but we could not switch over until very late on Sunday night, the 16th. Each day has seen a strengthening, and by midweek, the Western Cape was the first public sector department to take control, and then others have followed, some of them site by site, but as I said, now 5 provinces, a significant number of private sector sites, and parts of the remaining 4 provinces. So the gearing up has been, I think, wise, because we've been able to learn from the first to implement, and we've been able to identify where there might have been small programmatic changes to make the system more efficient. From now on, of course, it's possible to ramp up numbers quickly, because we know how the system works, we know where people are, we have the supply chain dates far more confidently than we had a week ago. And it's just all around easier for the staff on the ground who already have experience with working with this new vaccine. So I would like the public to know that we understand the challenges. We can only apologize where individuals have been affected, but we should see those teething problems disappearing or being an extremely small number in this week and going forward.
Dr. Crisp, NHI and the complete buying of it for South Africa. Now, I don't want to compare with regards to what's happening in the United Kingdom, but I've spoken to relatives in the United Kingdom, and of course, over the time that the NHS has been there in the United Kingdom, it has seen its success. Of course, it has seen, of course, the close to the total population of the United Kingdom. How close are we to seeing NHI have its complete sort of control of the healthcare facility here in South Africa? Of course, there is going to be the battle or the challenge from the private sector of the medical facilities here in South Africa. But how close are you, as obviously someone who's part of the NHI, to see this taking control of South Africa's healthcare, and of course, eventually having equal healthcare for each and every citizen?
Okay, so just a few introductory comments, then I'll answer your question directly. The first one is that the United Kingdom's been at it since 1948, and they do not have the huge diverse problems that we have with inequity in this country. I mean, ours is a historical legacy, but it's entrenched itself in everything that we do in society today. So the premise of our reforms, our broader health sector reforms, is that this inequity must be done away with, and that social solidarity is essential if we're going to bring more healthy people into the workplace and build our economy. That's the bottom line. We cannot have two parallel systems where the haves have and the non-haves don't have, and think that we are happy. So we are. The National Health Insurance Bill is in Parliament at the moment, and the Parliamentary Portfolio Committee is in the process of hearing public people who have requested to make oral submissions in Parliament, and that parliamentary process will ultimately end up with the tabling of a bill and hopefully enactment. I have no way of knowing how long that's going to be, but we sincerely hope that that will be concluded this year. There will be challenges, but there will be, what we are trying to do with National Health Insurance is make sure that every one of us, I who have a good job, somebody else who has an even better job than mine, and the person who has no job at all and is struggling, do not have to pay anything at point of care, no matter where we get the care, and we are paid for by the National Health Insurance Fund, which we have funded through our taxes. That's the bottom line. That's where we're headed towards. So it's a financing system. We are not intending as a country, and the bill does not attempt to nationalize private healthcare provision. So private hospitals, private GPs, physiotherapists, optometrists will all still be there, and they will still be part of the delivery system of the providers of healthcare in this country. They are a critical part of the delivery system of this country, and we do not want to undermine anything that they do or let anybody think that they are not an important part of the system. The problem is at the moment, that very significant sector, which comprises 50% of everything that we have in the country financially, and more than that in terms of specialists, oral healthcare practitioners, and so on as a proportion, is locked into providing care to a small portion of the population. We would like to change that balance, and we would like to pay everybody out of one common system, so that really what we will do, all of us, you and I and everybody who's listening to us speaking here today, will know that the only thing that will dictate whether we get healthcare is that we need it, not whether I can pay or you can pay. That must be irrelevant. Thank you.
And of course, access to health is one of our core values here, part of the Constitution, and just a basic human right for us to achieve. Dr. Chris, I wish we had more time to obviously go ahead, and there's so much questions I wanted to ask, but hopefully I will be able to have you again when the next vaccination phase does come in. We'd like to say thank you so much for making time for us here on Truth to Power and ITV Networks.
Thank you for us.
No, it's an absolute pleasure. Dr. Nicholas Crisp is the Deputy Director General of the National Health Insurance. Well, as you can hear, the bill is currently in Parliament, so we wait to see, of course, whether it will be passed or there will be resistance to it. And with regards to the vaccine, well, you at home can make the decision on whether you want to go ahead and do it if you are, of course, a senior citizen. All I'm saying is that we need to find a way to get our economy back on track. Jobs have been lost, livelihoods have been affected, and as long as we can find a way to get the economy back on track and, of course, creating jobs again, that is, of course, our core value here in South Africa, and making sure that each and every citizen has a healthy life so we can find a way to curb the spread and fight COVID-19. Well, that's all I have for you here on Truth to Power. I will see you again, same time, same place next week. Assalamu alaikum wa rahmatullahi wa barakatuh.